Dr. Copper.
And I'm Dr. Brown. Today we will discuss with you our job at the CDC in Atlanta, Georgia, and a notoriously dangerous virus known as influenza, or the flu for short.
When your hand is raised, we will answer any questions you may have. However, it is rude to have your hand up while someone is asking a question or talking. So if you would please lower your hand, save your questions for the next opportunity, and listen to the question being asked in a respectful manner, it will be greatly appreciated.
Alrighty, let's begin. We'll start with you. What's your question?
Being a statistician in public health, what is actually your job?
Numbers is our specialty. We gather these numbers from populations and we assess certain odds and probabilities of such. Let's say contracting a disease, mortality rates after the disease epidemic, and likelihood of the disease spreading or mutating, and so on. We apply this knowledge to data for the disease and other public health issues.
So how do you collect statistical data?
We could collect stats from just about anything: surveys, the census, experiments, observation. After analyzing the data collected from any of these resources, we can start to notice trends in the populations where certain diseases are more common, and if it's performing an experiment on sample size population, what is likely to be associated between exposure and the disease being analyzed.
Wow, I had no idea stats was used in such a broad way. Thanks, Dr. Brown.
Okay, next question, you.
So I was just wondering, what other fields of study could the statistics gathered in public health be used in?
A wide variety. These statistics could be used in fields of epidemiology, behavioral science, and even economics. Our findings are very important. We try to make it so that our findings are integrated in each field to benefit the public. Reliance on statistical data, it could also be important for policy making, and it makes it tricky because a lot of our work is confidential.
So one more question. If you don't mind me asking, what is the latest issue statistics is being used in?
Recently, with the new cases of Ebola in the United States, it's been data regarding emergency preparedness and emerging infectious diseases.
Okay, that makes a lot more sense. Thank you.
Vaccines are very cheap, and you can get them at your local pharmacy, no appointment needed.
So what are my chances of getting the flu without the vaccine?
Well, we couldn't tell you your chances as of right now, but we can tell you some statistics regarding the flu. Between 5 to 20% of the U.S. population will get the flu each year on average. Between 200,000 people are hospitalized each year due to flu complications, and over a period of 30 years, the number of people who die from the flu typically range from 3,000 to 49,000.
We basically collect data to track influenza patterns and measure the impact of influenza in the U.S.
Next question, you.
Why should I get the flu shot if it's a disease that was dangerous years ago?
The flu is still a deadly virus, and your chances of getting it is significantly increased if you don't get the vaccine. For example, the swine flu epidemic of 2009.
Hello, I'm Dr. Copper with the National Center of Health Statistics, a department of the CDC. With the swine flu pandemic over, I would like to provide you with statistics from the year. From April 12, 2009 to April 10, 2010, there were approximately 60.8 million cases, with over 200,000 hospitalizations and over 12,000 deaths in the United States due to H1N1. 87% of deaths occurred in those under 65 years of age, with children and working adults having risk of hospitalization and death 4 to 7 times and 8 to 12 times respectively than estimates of impact due to seasonal influenza covering the years 1976 to 2001. In our study, adults 65 years of age or older were found to have rates of hospitalization and death up to 75 to 81% respectively lower than seasonal influenza. These results confirm the necessity of a concerted public health response to H1N1. Based on data from the Behavioral Risk Factor Surveillance System and the National 2009 H1N1 Flu Survey combined, as of the end of February 2010, between 72 million and 81 million people report reported having been vaccinated against H1N1. Preliminary analysis showed vaccination coverage higher among children than adults, and more than 2/3 of those who received the 2009 H1N1 flu vaccine were in the initial targeted groups recommended by the ACIP. The 2010 to 2011 flu vaccine is expected to protect against 2009 H1N1 as well, and we highly recommend all citizens to be vaccinated in order to avoid pandemic from reoccurring. And now to our correspondent in Mexico. As you can see, vaccines are very useful in preventing diseases like the flu. This concludes today's press conference. I hope everyone has learned a little bit about what we do at the CDC, as well as if you should consider getting the flu vaccine based on the statistics that we told you. I hope it's a no-brainer.
Wow, you know, I think I'm gonna go get my flu shot after hearing all that.
Yeah, same.
Shots.